Be just a moment. Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Today, I have not one, but two fabulous plant-based doctors. I have Dr. Nathan Gershfeld and Dr. Renae Thomas, and they're going to be talking about some recent changes to Fasting Escape, which will allow you to fast at home under the supervision of a medical doctor. So first, let's welcome back Dr. Nathan Gershfeld. What a fabulous idea you had here.
Thanks so much, Chef AJ. Again, congratulations on your 1,000th episode. I watched the episode Rich Roll and also the recent one with Dr. Lyle was great. So,
oh my God, he's amazing. It's so funny when people people really love him, but every now and then, I'm sure you know, there's a couple of people that don't agree with them, and when they don't agree with them, they sure get angry, don't they?
Oh yeah, we can't avoid those people. It's the doldrums of the internet, I guess.
And a lot of times when they disagree with him, they're not even listening to what he said, because like they say, he said that, he never said that.
Right. Well, you know, there's an old proverb that a mentor of mine told me, and he said, those who say that it cannot be done should not interrupt the ones doing it. So
Exactly. And you're doing some great things at such a young age, having like a true South.
Well, yeah, a lot of my knowledge is from working at True North Health Center and the teachings of Dr. Goldhamer and Dr. Sultana and Dr. Clapper, all my mentors that kind of became my mentors when I was interning and working at True North. And so I really appreciate, that knowledge that I got. And so coming down here, running Fasting Escape, and now with the pandemic, kind of going into a more virtual type of fasting. One other thing that has happened, which is wonderful, is that when I first started Fasting Escape, the retreat center, the actual in-person fasting place, Dr. Thomas, well, at the time was just Renae Thomas. She reached out to me. I don't know how. I think she actually saw me on your show, Chef AJ, and she thought, "Oh gosh, like I didn't know there was a fasting clinic down here." She was at the time she was working at Loma Linda University. I think it was her residency, and she came over. We chatted, and what turned out was just somebody curious about fasting. I found out that this was her goal, is her dream, is to learn about fasting, and to she had completed, I think, an internship, a short internship at True North. And so she was at Loma Linda and kind of wondering what she would do after she was done with her residency. And we talked and kind of maintained a professional relationship the whole time. And it turned into something where I could actually consult with her whenever I had some questions about patients coming in doing fasting. Sometimes they would tell me they were on certain medications that they didn't tell me before, they had forgotten, or they had certain symptoms that were coming up that I just needed a professional consult. And so that's what that became. And so it was with great joy that when she was getting ready to finish her residency, we kept chatting, and it turned out that the right move was for her to join Fasting Escape as the medical director. Because we obviously are expanding, and there's people out there that need to do a water fast or need to change their diet, and they need a medical doctor's guidance in order to phase down their medications and to give them some advice, especially with some rare and some particular conditions and all the interactions that happen with all the other medical doctors that are on their team. And so I do want to introduce everybody to Dr. Renae Thomas, to just take the floor and answer some medical questions and let you guys ask away.
Great. Well, welcome, Dr. Thomas. You were on the show once before for a very special week for Australia lifestyle medicine doctors.
Absolutely. I'm so happy to be back. Thank you so much for having me again. And it's really fun to talk about this new role and things that we're doing together and kind of introduce everyone to that aspect of it. Absolutely.
Right. Well, we already got questions right out of the gate, like right away. There was a question from Anna: fasting with type 2 diabetes?
Absolutely. I think, the kind of small disclosure, obviously YouTube cannot constitute medical advice, but just having that professional opinion in line with medical training as well. So type 2 diabetes is, at least in my opinion, one of the greatest medical conditions that responds extremely well to fasting and extremely quickly compared to some other conditions that are more challenging. In terms of lifestyle medicine as a whole, type 2 diabetes is one of our kind of favorites to treat in a way, because it's rapid response to nutritional changes experiences, and fasting can just further greater that experience. Absolutely. If someone's taking medications, that kind of goes back to what Dr. Gershfeld was saying, is it's probably helpful to work with someone like myself where we can help you come off medication so that then you're safe to enter a fast, especially if you're on insulin or something like that, that would definitely need to be tapered down and kind of get you eating a little better and adjusting to the diets that we recommend, in able to then be safe to do a fast. But absolutely one of the top conditions I recommend for fasting.
Nice. But they can, even if they're on insulin, they can still fast?
No, so no fasting on medication. There's virtually no medications that are safe to do a medically supervised water fast on. So there's a couple of exceptions, but they're few and far between. Most people would need to come off almost all of their medications before they would safe to do a water fast. Now, if we're talking modified fast, like juicing or just, transitioning to a more health promoting diet, then that would be something that we could potentially work with medications. But in terms of the fasting and the water fasting, no, you would have to be able to transition off medications. The good thing being, despite popular belief, is that the majority, honestly, of people that are struggling with type 2 diabetes are able to transition off their medications when they transition to a more health promoting lifestyle.
Nice. Is one of the medications that people are allowed to be on by any chance thyroid medication?
That is one of the ones that I have experience with. Again, I'm similar to Dr. Gershfeld. My training in fasting was at True North Health Center. And so most of what I do in terms of fasting has been what I've learned there. So most of their guidelines are very similar to things I'm comfortable with. Obviously, we all have our personal spins, and I've, trained in slightly different areas through my residency. So there's some things that I might do differently, but the vast majority of guidelines are very similar. And you are correct. Thyroid medication is one of those, because that would be for people where their thyroid is at a point where it's not even producing enough thyroid hormone. Typically during fasting or even during health promoting lifestyles, people may need an adjustment on the dose, but that is one that is considered essential. So it would be permitted during fasting.
Great, thank you. There's a live viewer asking if you would recommend a juice fast for gastroparesis. They have a friend who has that. Would fasting help her? Or maybe a juice fast or a regular fast?
Gastroparesis has a lot of underlying causes. So it would probably be something that would be helpful to talk to them and kind of figure out where that gastroparesis is coming from. A very common place that I do see it is someone with type 2 diabetes. Unfortunately, when diabetes is in an uncontrolled state, it can damage some of the nerve endings that innervate the gut. Gastroparesis, for those that are not familiar with it, is very slow digestion or slow gastric emptying. It's typically diagnosed through a study where you swallow some radioactive food in a way. It has a tracer in it, not technically radioactive, but that's kind of how we monitor how slowly your food moves out of your gut, in particular the stomach. So going back to the original question, I don't want to defer too much. It would depend on the underlying cause and what they're trying to achieve with the fast. So the biggest outcome, I'm sure Dr. Gershfeld has said this multiple times, the biggest benefit of fasting is the transition to the healthy lifestyle afterwards. So if someone's coming in and they have gastroparesis that's very diet related, or their foods are causing problems with it, which for gastroparesis in particular, a lot of really fatty foods, greasy foods, they digest even slower, exacerbating the gastroparesis. So if someone was fasting to transition to a more health promoting diet that helped with their gastroparesis, I could see a benefit for it there. I don't know if fasting in and of itself would be a cure for gastroparesis. That isn't something I've seen a lot of times. It would depend what the underlying cause is, in which case it may improve it significantly. I think that would be one where I'd probably want to find out a little more information from the person before making kind of a blanket statement for recommendations. Have you ever seen someone with gastroparesis?
Yeah, it's a lot of times what we're trying to do is just give the body a break. And so this is exactly why I have Dr. Thomas on the Fasting Scape, is if you just heard a beautiful explanation that blends the medical science along with the idea that your body can actually heal itself if given the right conditions.
Absolutely.
Nice. And people, they can still have a consultation with you and not necessarily have to fast.
Correct. Yeah. And that's
Absolutely.
that's the main thing. Dr. Thomas has a lot to offer, as you can just see in just this one answer that she's given. So this is for consultations for Dr. Thomas in general, not just fasting. So there's a lot of people that I will talk to that may be on medications that their doctor isn't very supportive of taking them off the medications. And so that's where they'll book a consult with a medical doctor that is supportive of this, but they don't necessarily have to fast.
Great, thank you. Andrew, who's watching live, hi Andrew, asks, can someone fast if there is a suspicion of an asymptomatic gallstone or if they have gallstones?
That's super interesting. And it's an interesting question. The thing that comes up with gallstones all the time is how many people are actually walking around with them, but they're asymptomatic and don't know. One of the biggest things, I kind of joke about it, but it's sort of true in medicine, that the more you look, the more you tend to find. Someone has an image for one thing, they find something else, they have to have further imaging for something else or another test, and it can kind of snowball a little bit. So a lot of people find out that they have gallstones just because they had something else imaged in their body, and then the radiologist saw gallstones and commented on it. Typically, for most people, asymptomatic gallstones are not a problem. Now, when they can become a problem is if someone engages in something that may exacerbate the gallstones, either moving them or inflaming them. That would be kind of whether that causes inflammation in the gallbladder itself, or a problem where the gallstones move and potentially block something else. Certain stressful conditions can cause a little increased chance of having problems with the gallbladder, in particular rapid weight loss. So if someone was engaging in a fast and had rapid weight loss, it could increase their chance for having issues with the gallstones. But I would largely say that I wouldn't entirely eliminate someone from doing a fast if they had asymptomatic gallstones. It would just be someone that might be a higher risk that would have to be monitored if they started having abdominal pain, nausea, vomiting, things beyond normal expectations of fasting. Probably would be someone I would have a little lower threshold to stop more likely to end the fast sooner if they were having symptoms, or go into more investigations prior, making sure their labs are okay, potentially doing some imaging and seeing what their gallbladder status looks like before engaging in a fast.
I remember like at True North, they would end the fast, but they had parameters, like they were coming in twice a day to take the patient's blood pressure. They would have urine and blood tests. So if somebody's fasting at home, how do they know these things?
Yeah, we are able to get their blood work, and in cases of very complicated patients, then we actually will recommend that they go to True North Health Center or any of the inpatient ones, because we just don't have that type of monitoring at home. For remote fasting, it's really a uncomplicated type of patient. So if they can get blood work done, if they want further testing, like I've had a few patients who have nodules, like a thyroid nodule, whatnot, they'll go to their physician and get it checked, do an ultrasound before or after, things like that. And so that's a good way to know whether things are going on. But for very complicated patients, yeah, remote fasting is not going to be, it's going to be better to be done in an inpatient setting.
Great, makes sense. Mandy asks, can fasting help interstitial cystitis? And if not, what can?
Interstitial cystitis, I feel so sad when people tell me they have that. But the good news is I have seen great results with transitioning lifestyle. So interstitial cystitis, in terms of symptoms, for all the ladies out there would know, it's very similar to having a urinary tract infection, but they feel like that all the time or very regularly. But when you test the urine, there's no infection. So you go to your doctor, you're like, I think I have a UTI. They test you. Then they say, I'm sorry, there's nothing we can do because there's no infection. Maybe you should drink a little more water or something like that. And it's not a super well-known condition what causes it, but it seems to be irritation to the bladder that makes you feel the same kind of symptoms as a urinary tract infection. So urgency, frequency, burning when urination, very uncomfortable symptoms. And a lot of people are trying to figure out what the triggers are that are causing it. And actually, one of the most common triggers is what people are eating. And I have found many, many times when we transition someone to a lower sort of an anti-inflammatory plant-based nutritional pattern, their symptoms get a lot better. And we think that has to do a little bit with the acidity of the urine balance and just the inflammation in the body in general. With interstitial cystitis, the bladder is very inflamed. And so by reducing that inflammation as a whole, a lot of people start to get significant relief of their symptoms. Some of it's behavioral practices, but that's not super relevant to this talk. But it'd be something I'd be more than happy to talk to people about, all the ways they can address it, because it can be a very troublesome ongoing symptom for a lot of people.
Yeah, great. Thank you. A lot of people think that fasting slows their metabolism permanently, but that can't be true, because then right?
Metabolism is a very hot topic. And I think that the reason it comes up with, slow or fast metabolism is really a lot of people not truly understanding what the metabolism is and what it means by talking about the speed of the metabolism. And I could talk way too long, but trying to keep it super brief is a lot of the metabolism is controlled by our hypothalamus. And that's a part of the brain that really determines, one of its major roles really is to stop us from starving. And so it tends to slow down our metabolism if we're at risk of starvation, to make sure that we don't lose too much weight and end up, passing away or something horrible like that. But your absolute speed of your metabolism doesn't really determine your weight, because the smaller a person is, the slower their metabolism actually tends to be, because it doesn't have to utilize as much energy to move around a larger human. So typically, if you're much taller or much heavier, your metabolism is much faster. So most people think fast metabolism means I'm going to be slim, but typically that isn't the case. Now, to kind of refer that then to what we're talking about with fasting is, will fasting slow my metabolism permanently? Well, no, because your metabolism adapts to your lifestyle. So while you are fasting and you're not consuming any calories, if we're talking a water fast, of course your metabolism is going to slow down because you don't need to metabolize any food or any calories. But once you start eating again, your metabolism is going to speed up appropriately to the type of foods that you're eating. Now, some people think about long-term metabolic suppression, and we do see a little bit with chronic dieters. It doesn't seem to be the case with water fasting. Water fasting often seems to be almost a reboot and recalibration for people, that when they start eating again, it may actually go back to a more appropriate speed for their body rather than being permanently slowed.
Nice. Thank you.
Does that make sense?
Yeah. And I just remember once at
Dr.
True
Thomas, everyone right there.
I just remember once at True North, there were these two ladies at the salad bar almost yelling at Dr. Clapper because they had lost a lot of weight during the fast. And then when they started eating, some of the weight came back on. And I think people that are doing it for weight loss are very disappointed sometimes.
Yeah, there's two really important things to think of to answer that question, though, because a big part of when we're fasting is actually the body does a lot of diuresis, or we lose a lot of water. A lot of people are carrying around lots and lots of pounds of water, and they don't really realize. And that can be from salty foods and inflammatory foods, and also just the effect of fasting. We tend to lose a bit more water than we would on a daily basis. So once we start eating again, especially high water foods like salads and juices, we're going to regain some of that weight just from rehydrating the body. Then, of course, when we introduce carbohydrates hold a lot of water in the body. And so having quite a few pounds, I mean, I'm not talking anything crazy, maybe a couple to 5 pounds weight regain pretty soon after fasting would not be uncommon, and is certainly not unhealthy, and is definitely not fat regain. So I think that's an important part to think about. The other part, when I hear people talking about when they lose weight and their metabolism slows down, like I said, your metabolism actually matches your body size. So when you're in a smaller body, having lost some weight, your metabolism is actually going to be slower because you don't need to have such a fast metabolism. That's one of the unfortunate things that happens, but that's kind of the way that the human body works. We can't keep the same metabolism that was required to operate a big system or a bigger body, that now we're operating a smaller system and a smaller body on a kind of calorie per calorie basis. You are probably going to have a slower metabolism or consuming less calories to maintain your new weight loss, but it's usually not as substantial as people think it is. It's usually only a couple, maybe less than 100 to a couple of hundred calories, not as much as people think it is.
Yeah. That's why, well, people are also disappointed when they do like keto too, because they're not losing fat really. And the minute they, eat a baby carrot, the weight comes back on.
Well, that's why people love keto, because when they first start it, they drop a bunch of weight because they're not only losing their glycogen storage, their water, and then the diuresis from going on a diet, but they have this pretty rapid weight loss in the beginning. Unfortunately, it's pretty short-lived. And the problem being for long-term sustainability of weight loss is a lot of these high-fat, high-saturated diets, they set up long-term insulin resistance. And now when you eat carbohydrates, the response becomes exaggerated because they're not able to process that glucose anymore because they've restricted it, and they've made the body, I don't want to say toxic, that's the wrong word, but the insulin receptors don't like saturated fat. And so you're kind of setting yourself up for long-term insulin resistance, which will make it hard to maintain your weight long-term. It's why people like yourself, AJ, have been so successful with a low-fat plant-based diet, because you have great insulin sensitivity. You can eat a bunch of carbohydrates, metabolize them super well, and maintain a low body weight that most people think is absolutely impossible, but really that's the way the human body is designed to work.
Thank you for saying that, because I after 10 years of keeping my weight off, I experimented with adding fat, and guess what happened? Yeah, it wasn't water weight gain. So I love the ability to be able to eat as much as I want, so that's important to me, rather than having, peanut butter, I suppose. But yeah, that's cool how that works. Well, thanks. So we have a question from a live viewer named Stephen. I was recently hospitalized for biliary pancreatitis with infection. Would a water fast be appropriate to rest the pancreas and recover?
That's a very interesting question, because when we have pancreatitis, the first line standard medical treatment is actually fasting.
In the Merck manual. Yep.
Exactly. And when I I didn't want to go too much into what I've done, but I did do residency, like traditional medical residency. I'm a family medicine doctor, board certified. I have a couple of others, but they're irrelevant to this conversation right now. But board certified family medicine. So I can work in a hospital, I can work out of a hospital, I can deliver your baby, basically anything. It's a very general doctor. And so I've treated severe conditions like that in the medical setting, and pancreatitis is not that uncommon. Now, biliary and all the particular types can vary, but pancreatitis in and of itself is treated by fasting. Now, usually we give people a lot of IV fluid. So if someone was doing it for that reason, I wouldn't recommend just fasting for pancreatitis. It's usually something you're hospitalized for. However, keeping the pancreas at rest, having a bunch of water, and then transitioning to nutrition is usually relatively fast, though. Most of the current literature says within 24 to 48 hours, if you can tolerate some kind of nutrition, go ahead. Now, if that would be something like juice fasting or vegetable broth or fruits and vegetables, I think that would be wonderful. And in terms of healing the pancreas long term, I certainly think it would be a condition that I would definitely consider could be beneficial for someone.
Great. Hope you feel better, Stephen. Maybe.
Absolutely. Poor thing. Pancreatitis is not a fun time. I've never had it personally, but I've treated a lot of people with it and they never look very happy. It's a kind of a very painful condition. So I hope they're getting well.
How does it work when somebody chooses to fast at home? Do you like Skype with them or Zoom with them in the morning and in the evening? And
Yeah. So how it works is when I do a consult with them, if they're an uncomplicated case, then we just go ahead and I talk to them every day when they're fasting. If it's a more complicated case and we need a medical consult, they will book a consult with Dr. Thomas and she'll evaluate them and then make a recommendation whether or not it's fasting, or give them a sheet of a wean down schedule for the medications or some sort of schedule where when they achieve this particular number, then they can start fasting. And when they do, then we talk on the phone every day. They check their own vitals. Sometimes we chat 2 or 3 times a day, depending on how they're doing. And just following up with them, making sure they're drinking plenty of water. And then I'm doing, talks once a week or so, a couple times a week, just kind of, doing talks on fasting and whatnot, where people kind of can interact with each other. But yeah, we're checking in with them every single day at the minimum, and then doing regular blood work.
Nice. Julie wants to know, is fasting for a day helpful? How long can one safely fast at home without medical supervision?
So the general recommendation is, you can fast 1, 2, 3 days on your own. It's just that the longer you go, the more risky it gets. Okay. And so that's the whole idea is, especially today when many people, we don't really know somebody's on medications, they're not on medications, they might be withdrawing from, say they're drinking a lot of alcohol and they now stop the alcohol completely. They can go into some withdrawals that are pretty harmful. And so it's always useful if the more complicated your health condition, the more the safer it is to actually get a consultation. But 24 hours fasting is like skipping a meal, from being sick or getting a stomach bug. So generally not a big deal.
It's like Yom Kippur.
Yeah, except with the water though.
Yeah, I think one of the benefits when we're talking, because a lot of people ask that question, why can't I just do it on my own? But it can be, a bit of an art to really recognize what is a concerning symptom or not, and knowing when to intervene and when to stop fasting. And I don't know, I think there's a lot of highly motivated people that maybe are borderline a little stubborn, and you might be wanting to push yourself a little further than would be medically safe. And having that objective third party, I think personally is helpful in terms of the medical supervision to know what's safe and what's not safe. I don't think you should ever be really your own doctor to too much of an extent, at least not unless you've had advice from someone else prior.
Makes sense. Dr. Thomas, this is, when I say a personal question, not deeply personal, but it's not about fasting, but it's a question that almost every guest gets. What is your daily routine like in terms of food and exercise?
Oh, wow. that is, I change a lot. So let's talk nutrition wise. I am really boring with food. As I probably told you when I was last on your show, AJ, I've been plant-based my entire memory of my life. So, and I was raised to be SOS free as well. So I didn't have any salt, any oil, any sugar growing up, and I ate a plant-based diet. So I'm not one that has particular cravings or drive to eat out a lot or do anything. So for me, my diet, I would consider to be pretty boring. I predominantly eat a whole food plant-based diet. I probably eat a little higher protein to some other people, still plant-based, obviously, but mostly because I exercise a lot. I really like weight training and I'm naturally very slim. I try to keep a little more muscle on my body and that's what works for me. So I typically eat 3 meals and a couple of snacks. I vary a lot of vegetables. Honestly, not that dissimilar to the guidelines that you have, AJ. Pretty low fat, whole food, plant-based, more vegetables than people think are normal to eat. I eat a couple of pounds a day, very similar to your recommendations there. And I keep it pretty low fat, and that works well and feels great for me. I typically do yoga when I wake up, and I usually weight train most days, and I usually do some walking or some form of cardiovascular most days as well. I'm a pretty active person.
Well, somebody that was virtually raised plant exclusive, SOS free, what other job could you have?
It works pretty well for me. It can be, sometimes it was funny because I had to think, when people find it really hard to transition to a plant-based diet, well, it was helpful for me in a way, because I would think, let's just say all the medical research and all the health research suddenly said that we had to eat meat. I wouldn't know what to do. I wouldn't know what to buy. I wouldn't know where to find it in the grocery store. I wouldn't know how to cook it. I wouldn't know how to season it. It would feel weird. I would be like, am I even doing the right thing? And I think sometimes people feel like that when we talk about plant-based nutrition. It's so foreign and they wouldn't know what to do. So for me, it's very normal and very comfortable, but I kind of can appreciate, if I had to think about flipping what I did, how challenging that can be for some people going to plant-based nutrition.
Yeah, absolutely. Okay, I just saw a question. Was something about antidepressants. Yeah, because my understanding is you cannot fast on those medications. Where
Correct.
did it go? Well, I remember seeing it, so I'm not making this up. So maybe you can talk about what would a person would do if they were on those medications, because you can't really
if they were on antidepressants and wanted to fast. Antidepressants can be a little bit hard to come off. They definitely take quite a long wean, and that's whether someone wants to fast or not. Typically, I'm also very conservative in the way I practice medicine. I tend not to do drastic things or high risk things. So I have had quite a lot of people that I've worked with to come off antidepressants and medications like that, and we generally take it over the course of 6 months to a year, typically. So that would be someone, if you were planning a fast, I'd probably push it out a little bit. That's to have your optimal, most cautious experience. When you look at medical journals and guidelines, most people can come off antidepressants in 6 weeks. I just find people do better if they take it a lot slower. So I would say somewhere in that realm, and that would come down to the person's level of comfort. I try to make things as comfortable and easy as possible for, high results and feeling great with minimal risk and minimal kind of burdensome symptoms to the person. So yeah, typically I would say if you want to fast, plan to do it in a year. If you're really, really wanting to do it, medically speaking, we could do it in about 6 weeks, depending on which substance they're taking, how much they're taking, how long they've been on it, and how many different drugs they're taking.
Right. So if they're on antidepressants, they should not fast themselves at home either, correct?
Correct. Mm-hmm.
Yeah, I don't recommend fasting at all on almost any medications.
Great. Thank you. Susanna wants to know, what do you recommend for someone who's been eating this way? It's been for a year, but cannot drop their LDL.
I think the first question would be is how high is their LDL? Because there is a level, I mean, we hear a lot in the plant-based world of, that 150 total cholesterol being heart attack proof, but there are certain individuals, it's about 20 to 30% of people that do have a familiar level of high cholesterol that may not be able to get it as low as 150. And they're people I usually say, let's aim for 180 and keep going from there. What comes down to then when they say eating this way, of course, is the question. And I've heard lots of people on your show, including Dr. Gershfeld's most recent one, is what are you actually eating? And I spend a lot of my time being like, that's great that you're following whole food plant-based, but what does that look like for you? What is your breakfast? What is your lunch? What are your snacks? What are your add-ons? What are your drinks? How often do you defer from that? LDL cholesterol is very responsive in general to saturated fat. And that's pretty low on a plant-based diet, especially if you're following a more low-fat whole food plant-based, where people that are vegan or following a plant-based diet that isn't as, low in fat, they tend to trip up with things like coconut oil, palm oil, and that's in a lot of the vegan processed foods and junk foods. That tends to trip people up there. Or just their total, maybe they're eating a bunch of nuts. People think that nuts are predominantly monounsaturated or polyunsaturated fats, but most of them still come with a fair chunk of saturated fat. So if you're eating a lot of nuts, your cholesterol can be hard to get down as well. The other thing to think about is often if you're losing weight at the same time, so if someone's been transitioning to this nutrition plan for a year, they may also be losing weight. And sometimes when we lose weight, because you're actually mobilizing some of that fat out of your arteries, your cholesterol can temporarily go up as well. So lots of different factors to consider there. But I would really that would be someone I'd love to kind of really go through what they're eating on a day-to-day basis and figure out where potentially they could be slipping up dietary-wise.
Nice. So Susanna, consider a consult with Dr. Thomas. Elizabeth saying, what about enzymes to help the pancreas to heal and recover?
So in a medical setting, it's not uncommon to provide pancreatic enzymes for some time, but it's not really traditional gold standard of care. Most people will do a short fast. So when we're in the hospital setting, we'd be giving IV fluids with nothing by the mouth. As soon as they start to feel better, we slowly introduce food. So it would be very similar to refeeding from a fast. You might we usually do clear liquids, then we would do full liquids being things like soups and smoothies and blended foods. Then you would slowly introduce, well steamed cooked vegetables, fruits and vegetables, and slowly progress the diet from there, recovering from pancreatitis or something similar. Typically, it's not an enzyme problem. I have seen some people use them, some people feel better taking them, but typically I tend to do everything I can before prescribing medications. Obviously, I'm a normal doctor. I can prescribe medications, but I try to do everything else first. So I wouldn't be jumping to enzymes. I would be kind of treating the more gradual approach with food first.
Nice. Here's a fun question, not about fasting, but it's a good one. You both can answer. What are your favorite books, podcasts, and documentaries?
Do you want to go first? I've been talking forever.
Sure. I think the first documentary that I remember watching in the health world was Forks Over Knives. And so that remains, it's always going to be in my mind. And the work of Brian Wendell has been just unbelievable to bring this to the forefront. And then I've also, there's another one that everybody knows, I think, called Game Changers. That's a recent one that came out. So that's the ones I can think of right away. The podcast, of course, I have a soft spot for Dr. Lyle. Yeah.
Which you are the producer of.
Yeah. So it's funny because I've never actually, before Beat Your Genes, I'd never listened to any other podcasts. And then when I started doing it, I think a few years into it, people were like, well, what other podcasts do you like? And I said, I don't know. I never tried it. So I started listening to a few others just to see. And that's when I made a new intro, because I realized, oh shoot, my intro sucks compared to all the other podcasts. And so yeah, that's my favorite podcast so far. For any of the listeners, we do have a new episode coming out tonight. We just had a little technical difficulties with the audio from last episode. So we're having a new one tonight.
Do you miss doing it live? There was kind of a fun element when you were taking the calls live.
Yeah. It was a lot of fun because we could get callers in and they would challenge or put Dr. Lyle on the spot or Dr. Hawk on the spot. But we did have some technical difficulties where we'd go live and I'd be stressing out a lot because the internet would go out or the podcast site wouldn't work. And so it was also hard to coordinate schedules every week at the same time. And so we end up doing it. Now don't do it live, but it's a different model, but I still like it. So, and then what was the third one, Chef AJ, that you said?
Books. Podcast, documentary.
Yeah, without a doubt, my favorite book is The Pleasure Trap. Okay. And the second favorite book right now is actually Anatomy of an Epidemic. Okay. And so we just had a question about antidepressants.
I literally have it here.
Yeah, there it is.
I was reading it just yesterday.
Yeah. So this is actually for the person who asked about antidepressants.
That was Gina. I finally found her question.
Yeah, Gina, you have to go read that book. Okay. And schedule a consult with Dr. Thomas or any medical doctor. But you schedule a consult, but you have to read this book first in order to understand where it is that we're coming from. Okay. And that's where we're getting all of this, a lot of this information from about antidepressants not being super effective for many things. So those are my two favorite books so far. I've got a bunch of others. I think I've got two cookbooks that I love. It's your cookbook. It's actually the one in the back of Secrets to Ultimate Weight Loss. And then Kathy Fisher Straight Up Food Cookbook. So those are my favorite books in the plant-based world. So.
Thank you.
I have you on my bookshelf too. I was just looking. So he's talking about this one. We have those shout outs to AJ.
Yeah.
So I was looking back because I have all my favorite nutrition. I'm assuming they're asking for nutrition books, right? I have all my favorites on the back. I really like How Not to Die was a big one for me, and Brenda Davis's Becoming Vegan. They were some really helpful books for me in terms of learning from a medical perspective of how to help people using nutrition. I'm just looking if there's anything else. I mean, I love my entire bookshelf. I love a lot of the ones by Dr. John McDougall, especially the kind of older ones that he has one called A Challenging Second Opinion. And some of his older books I really, really enjoyed reading. If we're going totally non-medical, I totally loved Roald Dahl and I've read every book he's ever written. That was a huge part of my childhood. So separate to that. Documentary wise, I've always been a really big fan of What the Health. I think that it came at a really good time to kind of modernize some of the old classics. And for me, it holds a special place in my heart because I was actually lucky enough to talk at the Southern Hemisphere kind of opening of that. So that was really special for me. I always recommend that one. I think it's great. Podcast wise, I don't really listen to podcasts. I'm a huge YouTube person. And I spent most of my medical training listening to your show and a lot of other people just interviewing plant-based doctors. I guess Rich Roll podcast would probably be one, but I used to listen to it on YouTube because I wanted to watch the video. So they're probably the ones that I listen to the most in terms of kind of plant-based, was just listening to any doctor I could find that got interviewed and learning what they did and what was a reality and what I could see myself doing in the future.
Nice. Have either of you thought about doing a documentary on fasting?
That may be in the works, but we're not going to say anything just yet.
That would be cool.
But the world needs one. I think a forks over knives version for fasting. But
there was one, but it wasn't. Wasn't there one at one point?
Well, I know that True North Health Center, they've been around for a long time, and they're Dr. Goldhamer is my mentor, is just wonderful at, he's the expert on fasting. He taught me everything I know about fasting. And he had a brilliant documentary of, it follows a few of the patients in the old True North, before it was called True North, called the Center for Conservative Therapy back in Pengrove. And they had a camera crew following people around. It was a father and a son doing a 30-day fast together. And then they tracked other patients at the center doing a fast. And so that one is called Fasting Can Save Your Life. It's actually, if you were going to ask me what my third favorite documentary is, that's what it would be. I actually have it in my computer right now. I watch it every so often. But that's a really good one. I think it's now available at True North's, I believe they have like a Roku channel or a True North TV, something like that. And you can watch it there as well. But we would stream it here at Fasting Escape regularly. We have a little movie night for people when they come fasting. So, yeah.
A movie night without the popcorn.
Right. Just some ice water.
Oh, and if they're fasting on New Year's Eve, they get sparkling water.
Sparkling water, yeah.
So fancy.
Oh, Kathy says, how long do the fasting programs typically last?
It's different for everybody. So how it usually starts is we do a complimentary consult. So where we take a look at your health history, briefly look at what's your home situation like. We really don't want to be fasting you, doing a remote fast if you've got work that you have to go to, you've got to be doing all kinds of things. It's really a time of rest. You want to set your life up as if you're going out somewhere to do a fast. But we actually are kind of going through these different guidelines and determining what would be the ideal fast for your life situation and for your condition. And if it turns out you've got a pretty complicated condition that I'd want you to do a consult with Dr. Thomas, I'll tell you that, and you do that, and then we kind of brainstorm from there. Or if it's really complicated and Dr. Thomas says, now you got to be in an inpatient setting, then we ship you over to True North, and that's where you go, or Dr. UN Center. So that's what, everyone's a little bit different. We've done some short fasts, we've done some medium length fasts, done some long fasts. Everybody's a little bit different, and as far as what they need and how long they can go.
Nice. Thank you. Here's it from Rebecca. Can too much licorice root be bad for you? I use about 1 to 2 teaspoons per day in hot water for tea.
The only thing I've seen sometimes happen with licorice root is it can actually increase some people's blood pressure. It's one of the kind of, we don't learn a bunch about supplements and herbs and things like that in medical school, but licorice root is one that can increase blood pressure, especially at that kind of dosing. So I would just be mindful of the blood pressure with that one. Beyond that, there's certain people that would have gastric irritation or stomach upset from having that much licorice root. I think if it's well tolerated, the blood pressure is the main thing that I could think of that could be a problem there. I'm very much in line of keeping things very natural and simple. And when we start adding in a lot of isolated nutrients, we can start, isolated nutrients, concentrated foods, we can often start to run into problems. So a lot of those questions are really dependent on the person. Are you tolerating it? Is it causing adverse effects? Why are we doing it? Could we be doing a better option? And, what's your personal level of changes you want to make in your life? Like this comes up, this is kind of an aside, but it comes up a lot with coffee, for example. Like I don't recommend that people drink coffee, but a lot of people are absolutely not giving up their coffee. Okay, great. What else can we change in your lifestyle? And we'll leave coffee as kind of the last thing. And if you manage to reach all of your health goals, keeping your coffee, great. If not, maybe it's time to address the coffee. And I kind of approach that with when everyone says, what about this food? Or what about this food? Or what about this food? Right? It's always the dose is kind of, the poison is in the dose, and that varies for the individual. So it's not something I'd rush out and recommend someone doing. If it's working for them, great. I know that we're kind of similar, that Dr. Gershfeld and I, and that even though we recommend what would most people would consider to be quite a strict diet, I always say to people, do the least restrictive diet where you feel in your best health. That's fine with me. It's your life, not mine. If you're struggling though, that's where we can start to fine tune things.
That's very similar to what I've been saying. Do the least restrictive diet that will give you the results you seek.
Absolutely.
You know, it's interesting when people say, is this okay? You always know it's never something healthy. Nobody ever says, hey, Dr. Gershfeld, Dr. Thomas, is
Broccoli okay?
Broccoli okay? You know, it's always something that they must know on some level really isn't, or they wouldn't be asking, right?
Except for fruit. I get that one all the time. Can I eat a banana? Can I eat half a banana? Like, yes, we can all eat fruit, right? That's the one, that's the only healthy one I think I get is, can I eat fruit, and how much fruit can I eat?
Yeah.
Wow.
I think that's what we're hearing from these patients are the pleasure trap. Okay. And also a little bit of the confusion that comes from having access to the internet where everyone can voice an opinion about something. And so what you've got is, you know, you're correct, Chef AJ. We are correct about being able to eat all these foods. It's that people are just kind of trapped in this pleasure cycle where they want the most concentrated foods, and that will skew their motivation. And they're trying to ask for permission to eat the unhealthy stuff. But it's really not, it's not for us to give.
Yeah, to give our permission. Exactly. We'll just give our forgiveness. Somebody's asking, what is the best way to cleanse the liver? I know Dr. Clapper did a whole DVD about how liver and gallbladder flushes are basically scams.
Mm-hmm. Which is a great DVD, by the way. Also on True North's TV as well. So.
Yeah, typically in terms of the type of medicine that I practice and I'm familiar with in my area of specialty, we don't truly do things like liver cleansing. The body is very good at self-renewing when given the right conditions to heal and thrive, really. So most people wanting to cleanse an individual organ, be that the kidneys or the liver or whatever's coming up or the skin, typically I just recommend the same things I recommend for good health, because when your body is provided the good things, you know, good environment, good water, healthy foods, that puts your body in the optimal state for all of the organs to function well. And they probably don't need cleansing or detoxing. Your body's going to automatically do that when you're putting in the right foods and taking away a lot of the foods and the environment and things that are contributing to maybe whatever symptoms you think you have related to needing to do the cleanse of the liver.
Yeah. Oh, exactly. Okay. So a question. Oh, here. Kathy says, if it's in your house, it's in your mouth. Chef AJ, of course. So how does one prepare for a home fast? It seems it would be quite difficult to stay on track in your own environment.
Yeah, it's a really good question. And in fact, when I first actually started the home fasting, there was a couple of people, even when I started Fasting Escape, the in-person program, is I said, no, I'm not really a fan of at-home fasting. I'm not sure how that's going to work. And I had a few people during the pandemic where they said, well, I can't travel. My spouse, or I'm just nervous about COVID, and they just didn't, or they couldn't because they were trapped in a different country. And so what we did is actually a couple of days before they start fasting, when they're doing the lead-in diet, is we actually clean house, okay, which is super useful for both during the fast and after the fast. So they actually get rid of everything in their house that's going to be tempting them. Okay. And so it turns out if they have a spouse in the house or they have kids, then they just have areas that they don't go in the house. And I thought that this was going to be a big issue as the fast goes longer, but it turns out the hunger is lost after a couple of days. And just knowing that they're talking to me every day, people are actually able to stick to it. So I have yet to come across somebody who's, you know, day 5 into the fast, and they're like, oh, I accidentally had to go in there and get a carrot or a watermelon or whatever it is. Okay. They're definitely a risk. And that's something that we want to make sure that if there is something in the house, that it's only healthy foods. But we still haven't had any problems with that yet. So
that's great.
Yeah.
Victoria says, what is your opinion on watermelon fasting and dry fasting?
Dry fasting, from my perspective, is a hard no. There's absolutely no case that I would ever personally recommend that or personally supervise that. That is one of the major areas in fasting that has given medically supervised water fasting a bad name. You can run into problems really fast. I have listened to a lot of the supporters of it because I'm personally one of those people. I am never closed off to an opinion. If someone has an educated opinion or something I don't know, I am more than happy to listen to it. I can't tell you how many hours I've listened to on dry fasting and experts in the area. there, and I'm still not convinced that it's a health promoting practice. The biggest concern for me is the kidneys. They need to have fluids. And when I, working in a hospital setting, one of the most common reasons someone is hospitalized is dehydration. We immediately see kidney injury, a rise in the creatinine in their body, emphasizing that the kidneys are not processing the toxic waste in the body properly, and they're not being filtered by enough fluid. You immediately treat someone with a kidney injury by running fluids through their body. So someone that is dry fasting, meaning they're fasting and taking in no water, I just cannot see that being in any way health promoting. In fact, someone I actually knew peripherally, professionally in Australia, actually ended up passing away from doing a dry fast. And this was a professional in fasting, and they passed away themselves from dry fasting. I am just very concerned with just the concentration of things happening in the body and the limited ability to filter the kidneys while someone is dry fasting. It's surprisingly a very common cause of elderly people passing away is they fall, they can't get up, they are not found for 3 or 4 days, and they've been dry fasting for that time. They're in kidney failure and they pass away. So maybe it's something in the future I need to have more experience on. I feel like I've done a lot of research on it, but I cannot find anything medically sound that would make me encourage dry fasting at all.
Yeah,
Go ahead.
That's what Yom Kippur is, dry fasting. And I don't understand how there's ever a benefit withholding water from anyone.
Yeah, like I said, it may be a gap in my knowledge, but I'm yet to find a reason why I would ever promote that. I'm so sorry, and maybe people have had great experiences, but personally, it's a level of I just have not found anything. Yeah, we definitely do not do that.
Yeah, we don't do any dry fasting. True North doesn't do any dry fasting. My mentors never taught, never taught us about dry fasting. We just never. It's just not safe for your kidneys and not good for you at all. So.
Yep. Yeah. Here's a question from Bella.
The watermelon fast, I think.
Oh yeah, watermelon fasting actually sounds delicious.
Right. So yeah, let me go real quickly, and then Dr. Thomas can answer. So watermelon fasting, if we got to actually get to the definition of a fast. So fast in some ways can mean abstention from something. And so during Lent, people say, well, I'm fasting from chicken or fasting from a particular nutrient. The key definition, the at the heart of the word, the traditional definition of fasting is the complete abstinence of all food and drink, except for pure water in a period of complete rest. And so a true fast is actually just plain water. Now, if someone does a watermelon fast, then what they're just doing is eating nothing but watermelon for a prolonged period of time. And so that's no different than just a normal diet on watermelon. So if you're doing it for a week, probably fine. If you're now doing it and you're eating enough calories, probably okay. But the longer you do it, you're going to run into issues that people run into when they eat large amounts of one particular food, like a fruit, for long periods of time. But I'm sure Dr. Thomas, what do you say, Dr. Thomas?
Yeah, I think you definitely covered the basis from it. I have done a lot of interest in a lot of more fruit-based nutrition, and a lot of people with certain chronic illnesses do quite well in a more fruit-based nutrition pattern more than certain people just tend to thrive on that. I've seen quite a lot of success in inflammatory bowel diseases and some very more challenging to treat medical conditions that are really trying to do it from a nutrition perspective. I've had some good success with guiding people through that, but it's definitely not anything long-term sustainable. Again, the things that you're doing really by following just watermelon is you're removing a lot of the inflammatory substances and things that were causing the problems in the first place. And it's not that hard for people to stick to just eating fruit for a couple of days because it's quite tasty and they're able to stick to it. People can have some good benefits again by removing a lot of the problems that are there in the first place. But very similar to water fasting is I think the plan is to transition to a health promoting diet. And where I can see people sometimes slipping up is that they don't get that effect after fasting where everything tastes good, right? I'm sure a lot of people are familiar with the True North stories and fasting stories where things like zucchini taste wonderful when you haven't eaten anything for a couple of days. If you're just eating essentially pretty refined sugar. Fruit and watermelon is very healthy. Don't get me wrong. I'm not trying to say that it's the same as white table sugar, but you are really consuming a pretty fast digesting form of sugar for days on end if you're just consuming watermelon. My struggle would be how good does kale taste after just doing that? And it might be harder to transition to the nutrition plan. I'm kind of a mixed bag. I'm definitely happy to work with people that want to do kind of, I guess, fruit cleanses or something like that for a brief period. Modified fasting, exactly. It's very similar to how we use juicing and things like that. I don't think they have as many benefits as a short medically supervised water fast, but I can definitely see a benefit in an overall transition to a healthy eating plan.
Right. Here's a question. Is fasting beneficial for healthy folks?
Yeah, I think here's how we know that it might be time to fast is when you're healthy, you have no particular conditions and you lose your appetite for healthy foods. That may be a sign that your body needs to rest. Now, whether that means you go a weekend without eating, you're just resting, kind of just taking a little vacation for your digestive system, or that means you might need to do a longer fast, like a 5-day thing or 1 or 2 weeks of fasting. That's completely up to you. In general, people are not going to be willing to go through all the misery of fasting just because they're healthy and they want to just be, A++ rather than just A+. So in general, we tend to see people who have some reason to do a fast, like high blood pressure, diabetes, some autoimmune conditions, some skin rashes, psoriasis, these types of things. But, or they're trying to get a springboard to a healthier diet and a lifestyle. But if you're healthy and you feel like you need a little break because the food that you're eating is starting to taste bland and you're starting to add a bunch of salt or soy sauce or starting to get tempted, then it might be a good idea to give your taste buds a break.
Great.
I think another thing that could probably be said is the role for prevention. And a lot of this research is relatively new and quite biochemically complex when you look into it. But it does seem to be that there is some evidence for, short fasting, even just once a year as kind of a preventive aspect, especially in the world of anti-aging, things like telomeres on our genes, kind of, lengthening and shortening, and very, like I said, very technical research that's very new and evolving. But I think a lot of things, we know as we get older, cell replication and things in the body start to get less than ideal. It starts to slip up more, and that's why we start to look older and start to have more health problems as we get older, aside from the nutrition part. I mean, there's certain things, no matter what we do, we're still going to age. And there does seem to be a little bit of evidence towards maybe some regeneration, kind of preventing some of that aging process by doing short fasts, maybe on an annual basis or something like that. I think that's where I'd kind of throw in for healthier people. The evidence is still new and limited, but I think there's something there that if you're really wanting to do it and you're otherwise healthy, I certainly wouldn't discourage you from doing a short fast just to see if you feel like you're getting a benefit or something like that. Kind of minor things that I remember seeing at True North and other fasts that we've supervised is, just little things like sometimes skin moles can get a little smaller, and maybe that was heading towards a precancerous route, and now you've taken it back to, a benign or, gosh, I'm losing my word, a mole that has no problems, right? That might have been heading in the direction of cancer, and just that little fast may have kind of regenerated the body enough. Not trying to say that fasting can reverse cancer or prevent it, but there are little bits of evidence that may have some level of relevancy in the real world. The problem with a lot of data is that what happens in the lab doesn't always happen to real people, but there is definitely some research out there on fasting that I'm interested to see in terms of longevity kind of world and preventive medicine health. Will it have any benefits to us doing it when we're otherwise healthy to prevent things happening in the future?
Nice, thanks. Bella wants to know, are overt fats necessary?
There is a level of overt fats that are necessary. And we know this because in the hospital setting, when someone is not eating, we do have to provide nutrition, especially when it's been more than a couple of days. We can't just give IV fluids. And typically that's some kind of nutrition either given through the arm or sometimes it's given through more of a central line. And when they first started doing that in hospital settings, they actually excluded fats from it and people got very, very sick. So we know there is a level of overt fat that is needed. And that's typically coming down to your omega-3 fatty acids and your omega-6, because not everyone can convert the AHA to those fats in their body at a sufficient level. However, when we're talking added fats, or that's how most people use the term overt fats, is they're meaning, do I need to add nuts and seeds or avocados or something into my plant-based nutrition? I find that it varies on the person, but the amount is typically much less than people think. And people that sometimes need a little more tend to get very dry skin and very dry hair, and they're kind of struggling with the oil production, or they're very underweight and they just can't maintain a healthy weight and they can't eat enough food in their stomach capacity is not allowing them to maintain their weight. Fats are very concentrated in their both energy and calories and their nutrients. So they do have health benefits, but I think the amount really varies on the individual and it's typically not that much. I think that most people eating the thing that people don't realize as well is, even if you're eating a diet without overt fats, you typically will get to around 5 to 15% fat overall, which is sufficient for most people.
Great, thank you. There's a question here. Do you ever recommend any appetite suppressants, natural or not, if someone is on an out of control binge?
Generally not. And my reason for not recommending appetite suppressants is I've never seen one on the market, natural or otherwise, that does not have a rebound effect when the person stops taking it. And I personally try to avoid any medications or supplements that are considered for life as much as possible. The exception maybe being something like vitamin B12. But very rarely do I like someone to think of something forever. And the problem with the appetite suppressant is when you are suppressing your appetite and under eating, you're doing a couple of things. That hypothalamus I talked about with the metabolic rate is when your body starts to think you're starving, it starts to slow down your metabolism. It makes you very, very hungry. It increases your hunger hormones, decreases your satiety hormones, decreases the metabolic rate, and you're setting yourself up for a weight rebound. Usually when someone is, so the thing that most people are trying to do with binging is they want to correct it after the fact, when really I recommend for most people is focusing on preventing the binge in the first place, figuring out what is driving that. Binge eating disorder versus binge eating or reactive overeating can be very, very different things. And I think figuring out what's causing the person to overeat or to binge eat in the first place is going to be much more beneficial than trying to catch it at the end. The worst thing you can do after binging is to restrict your food because you're setting yourself up for another binge. The best thing you can do is kind of get back on track, eat sufficient food, and kind of carry on from there and figure out what caused the binge in the first place. Most people that binge have some level of under eating or dieting prior to that. And that's the part that needs to be addressed rather than kind of playing catch up after the binge. In terms of appetite suppressants, never.
Right. This is also where I'd recommend people follow with Justina, who you had on your show, Chef AJ. And then I don't know how to pronounce her last name, so forgive me, Justina.
Ruiz.
Yeah.
Ruiz.
Yeah. This schedule a consult with her. And she's the expert there. So, but sometimes a short fast, if we're in a stable place, can help to reset the taste buds so that healthy food can actually taste good if someone's in a bad cycle. But in general, yeah, we don't try to play around too much with that.
Right. Here is a fun question. What has been your most difficult client to date and why?
Dr. Thomas and I know this, right? Because we just did it.
Oh, that's definitely not the most complicated, but that was interesting.
Yeah.
Do you want to go first?
Yeah, I think it's hard to say specifically because of patient confidentiality, and it's kind of, we don't want to give away details, but what the kind of patients that Dr. Thomas and I like working with are people that want to take some responsibility for their own health. And so we're not trying to be there to tell them what to do. We're there to offer some advice and say, listen, this is based on our experience. This is what we'd actually recommend. And if that doesn't fit, no problem at all. But it gets difficult where when people have their own ideas about things that doesn't actually make logical sense. And so they're trying to add salt, or they're trying to exercise a lot, or they're trying to do things that are just, we haven't seen do very well with fasting. And so that's not a problem. I think as far as health goes, the difficult things that we deal with sometimes is people who have very high A1Cs with diabetes, okay, or they're on multiple medications and they're very sick and they need to come off of them. So with the first case, with both cases, we have to do a very sustained healthy diet beforehand to stabilize people, and then we can start to consider a water fast. But in all the cases, we want to be very careful to make sure that people are getting the care that they need. And making sure that if they need to go and do a water fast, whether it's at True North or Fasting Escape, a remote fasting thing, or just do some regular consults as a bit of a accountability doctor, Dr. Thomas can help them out to just stay on track in certain ways. That either one of those is all going to be fine. But I look at it like this: if we're going to try to learn to play soccer and get better at soccer, we're going to hire a soccer coach. Okay, we're going to join a team. We're actually going to do some regular practice. And so this is no different. We may need to work with Chef AJ or watch Kathy Fisher videos or watch the Dylan Holm videos for Well Your World and just learn the cooking, learn all these things, then get a doctor in their corner where they can actually make more informed decisions based on our experience.
Nice. I want to bring in the total flip side. I love a good challenging medical case. I had a reputation in residency, and anyone that trained with me will know this. I had the most medically complicated patients you could imagine. Everything, throw it at me. I love it. I always I always think of it like a real challenge, and I love it. I love figuring out the underlying root cause as to why someone is struggling with their health. So for me, I don't ever see my most challenging patients as a negative thing. For me, it's always been an opportunity for me to learn more, me to grow more, and me to be able to help more people in the future, because you start to see similar things and you're like, oh, that person I couldn't figure out, it ended up being this, and it takes me on lots of different pathways. So I love it. I say bring it on. If you're complicated, I'd love to see you.
Nice. There's a question if either of you fast.
Yeah, personally, yeah, I try to fast at least once a year. I'm a bit of a wimp, so it's not like I've done a super long fast myself, but I do need to fast, and I do that every year or so, sometimes a little more frequently.
Nice. What about you,
Yeah,
Doc?
I did a pretty decently long fast when I was in medical school. I had a bout of just some medical struggles, and it was actually one of the first things that got me that I kind of learned about fasting, because I was trying to heal myself, and I probably didn't do it in ways I would recommend, so I'm not going to go into the details, but I did a pretty prolonged fast and kind of modified fasting for quite some time and got some really, really incredible results there. Since that point, I've had a couple of times I've kind of done shorter fasts, especially for me, if I ever get a little under the weather. I feel that fasting tends to help me recover a lot faster. I don't get sick per se very often, but if I do, I tend to fast for the first couple of days, and I tend to feel better a lot faster. I've had a couple of times that I've tried to do fasting, but I don't have a lot of reserves. I'm relatively slim, and so my bandwidth for fasting is pretty limited. I've tried to go to True North a couple of times, and they've said no. So maybe one day.
Nice.
Yeah, all those all-nighters from medical school, I think your body, the body needs a little bit of rest. And for me, every time I need to fast, it's because I've gotten off the planet in some way, some shape or form. So.
Oh boy. Nice. What supplements do you recommend? Asks Lily.
Yeah, so in general, it's going to be, if you're strict vegan, B12, vitamin D, if you're not getting exposed to the sun. But I'll let Dr. Thomas take this a little bit more in more detailed way.
Yeah, no, you're totally right. I recommend it as absolutely minimal as you can get away with for good health. I see so many people, and all with good intentions. I mean, a lot of people that are coming, especially from this kind of plant-based movement, they're super educated on their health, and they've read all these great studies and things, and they're super educated on supplements, and they're on about 25. I just don't see a lot of benefits for a lot of them, but I'm very much for testing. If you think you need to take B12, or sorry, not B12, I meant to say vitamin D, the other one that you said. If you're thinking about taking vitamin D, let's test it. Let's see what your level is, and let's see if you truly need it. And I'm very one for kind of figuring out if someone truly needs supplements. There's not a lot that I recommend on a long-term basis, but I do work with people for supplements if they're particularly sick or they're recovering from something. Maybe their digestive health is off. Certain things like that we can play around. Certain medications actually have side effects. So a really common one that isn't that widely known is something like metformin, commonly used for diabetes, tends to cause B12 deficiency. So things like that, just kind of figuring out the individual. Are we compensating for something else in the lifestyle? Are you having a particular problem that maybe we're talking about prescribing medication? Could there be a supplement we could try first? That's kind of where I lie. But as a blanket statement for recommendations, most people don't really need many beyond the B12 is the real common one that I see. And that's really regardless if you're plant-based. Upon testing B12 on hundreds and hundreds of patients, most people could benefit from it.
Nice. Thank you. Where are you based, Dr. Thomas?
Ooh, well, I practice online, so I can see anyone in any state.
Nice. And let's see. Okay. No, this one was already answered. Sorry. We answered that one. There's just a lot. Stacy mentioned she interviewed Dr. T. Colin Campbell, and even he does water fasting.
Very cool. That would have been a fun interview. He's awesome.
Yeah, I've heard that he did it at True North Health Center. I don't know too many more details other than what I've heard from Dr. Goldhamer, but it appears like he did quite well.
Yep. Victoria says, Dr. Thomas, I am a very complicated patient. Can I see you?
Absolutely. It'd be my pleasure. Let's see what we can do to help you out.
Stacy says, have you ever seen people get off thyroid medication through fasting?
Well,
so, go
ahead, Dr. Thomas. Yeah,
you go.
I have seen people reduce their dosages, but what I've lacked in practice is the follow-up, because very often people do a fast. 6 months later, they write me an email, say, oh my God, I'm so happy I've been able to reduce my thyroid medication. but a year later, I don't know what's going on. So it depends on how long they've been on thyroid medication, whether or not they had hypothyroidism to begin with, and whether or not it was an autoimmune condition kind of masquerading, and the doctor decided to give them the levothyroxine or the thyroid medication anyway. And so then they really didn't need it at the beginning. And so what had happened was maybe the brain just stopped producing as much TSH. So it really depends on their condition. What we want to see is can the body improve its functioning? And sometimes that means you might just be on the thyroid medication, but sometimes it doesn't. But we don't know. It really depends on a number of factors.
Okay.
Yeah, absolutely. I mean, I guess so before coming on as the medical director at Fasting Escape, I worked in primary care at Loma Linda for 5 years, and that was both inpatient and outpatient. And so predominantly in the outpatient setting, worked with a lot of people on thyroid medication, a lot of people with thyroid problems. And there's actually a significant portion of people that I was able to take off their thyroid medication. Now, in the traditional medical setting, autoimmune diseases are typically considered incurable. They're considered chronic, lifelong diseases. Now, we know in the plant-based community that that's not true. And someone like Dr. Brooke Goldhamer is a wonderful resource for able to reverse a lot of autoimmune diseases. And so I typically follow a lot of her guidelines for people with autoimmune diseases, and I've had wonderful success in people, a lot of people improving significantly. It doesn't work for everyone. And I think some of that comes down to, for the thyroid in particular, what thyroid function is remaining, and is the body, how long is the person willing to stick it out with the diet and nutrition, waiting for the thyroid to see if it'll kick back in. And a lot of that can be quite frustrating because it's not overnight. It's not a fast cure. It could be something that could even take a couple of years. Mm-hmm. Absolutely. But I think that I would never lose hope, and I would do the best, but don't expect it to be a miracle cure. But I've definitely had great success in a lot of autoimmune conditions reversing and being able to come off medications that they previously thought they wouldn't be able to, which is really fun. That's one of my favorite things to do. I love taking people off medications.
Right. Allie says, does fasting help with chronic migraines and anxiety?
Yeah, in general, yes. So, chronic migraines may be due to a number of factors. It could be mechanical. Maybe you had a whiplash or something and fell off, hurt your neck. And there could be some reason there. There can also be some dietary problem there. So I think I read an article a few years ago that they're starting to suspect that maybe migraines is a sign of atherosclerosis as well. Mm-hmm. And so if we reverse the atherosclerosis, which we know a plant-based diet does, then we can reverse we can prevent this migraine from occurring. Anxiety is different. So there could be anxiety because you never know when you're going to have a migraine. So it's hard to live a life without anxiety if you never quite know. And so what we're trying to do is actually get to the root cause of the issue, which is, get you healthier so that you have less anxiety. The other issue is kind of we're kind of treating the body as a whole. So you might have some anxiety that's just underlying anxiety because you're just a hyper conscientious person, and that can just manifest itself in a number of different ways. But if your anxiety is due to the fact that you're not sure when you might have a migraine, it's disrupting your life, then yeah, it's worth it to do a trial of a super healthy diet. And if you're already eating a healthy diet, maybe a trial of fasting or even just a consult with Dr. Thomas to see if we can figure out if there's some other underlying cause.
Yeah, I think it's also, like you were saying, with treating the whole body. One of the things that I really like to get across with the health promoting nutrition and recommendations and lifestyle that we talk about a lot is that a lot of people ask, what about this condition? What about this condition? What about this condition? I totally understand where they're coming from, respect that, and happy to help out. But I think also the thing to think about is all the things that we know it can be helpful with preventing your risk for a lot of other diseases. And the last thing you need if you're struggling with one is another problem, right? So getting the body as healthy as it can, even if it doesn't particularly address your one specific thing that you're focusing on, will optimally, optimize the rest of the body and prevent anything else going wrong for a lot of people. So getting yourself as healthy as possible with the hope it will fix your condition is kind of the way that I generally approach it, because we are a big, one kind of unity as the body. Even though medicine loves to divide us into equal parts and have different doctors for different body parts, I think it's important to look at everything as the whole, get you as healthy as possible as a human, and then we can try and focus on specific conditions.
Wonderful. Susanna says, have the doctors ever seen people whose gums started receding on this way of eating?
I have seen that, but it was, I remember like 2 cases. This was when I was working at True North, and it was a couple of people that had been, eating a very unbalanced diet for several years, where I think someone was eating like 20 bananas a day and eating, 10, they were actually special ordering cantaloupe and watermelon because that's all they would eat. So they would be eating 10 watermelons a day. and they'd been doing something like this for a couple of years. So yeah, I think that's the only cases that I remember seeing that. So yeah, it's a very imbalanced diet was resulting in that, I believe.
Okay. Bella asks for advice on amenorrhea.
That's a big one for what's the underlying cause. So we have a lot of different causes for amenorrhea. It depends when it started. Is it primary or secondary? Primary being that you never started having a menstrual period. Secondary being there's some other reason why it stopped later in life, and trying to figure out where that's coming from. Most common things that I see typically imbalances in hormones like PCOS is a very common reason, or over dieting, over exercise, or being underweight are the most common things that I see. A lot of people transitioning to plant-based nutrition often have some amenorrhea temporarily because they're under eating, and a lot of that can be addressing how to eat on a plant-based diet and to get enough nutrition and enough calories, because the volume is vastly different for a lot of people, especially if you're coming from a more processed nutrition plan where your meals are probably this big. Now we're telling you to eat this much, your stomach says I can't, and that's where things like fats can come in for healthiness while they're trying to be able to eat enough to sufficiently get a menstrual cycle. So it kind of depends on where it's coming from. And that would be something that I'd probably have to delve into a lot more questions for before giving kind of a blanket statement, because PCOS and amenorrhea from over dieting or over exercising or not eating enough are completely different ways of treatment.
Yep. Do you guys have any experience reversing a severe case of either MS or Lyme's disease?
Yeah, I've had patients who come in with Lyme disease, and sometimes Lyme disease can look like an underlying autoimmune disease. And so, very often when they get benefit, I just say, okay, it was probably an autoimmune disease that was somehow just looked like Lyme. So I believe it's going to be tough to just reverse Lyme in general. Although I've had patients who had severe Lyme disease. They took blood tests before and after the fast, and their bands showed improvement, and their actual infectious profiles actually showed improvement. So it's hard to say and base that off of just half a dozen cases or a dozen cases. But my general attitude is let's take a look at the diet lifestyle, see how that's going, and then see what happens. Okay. With MS, yeah, it's going to be, I think there was a study on plant-based diet in MS, and there's some improvement. I believe it was Dr. Roy Swank, maybe it was, that showed improvement. So my general attitude is, yeah, why not? Why not try a healthy diet and see if there's improvements? And then if it makes sense to do some fasting, if they're a good candidate for fasting, then we can try that. I can't imagine that fasting would be harmful because there's so many net positive benefits that occur with the fast. But as far as data goes or research, it's not there yet.
I'm really surprised that nobody asked about fasting and cancer today. That usually comes up.
Yeah, I think there is actually a little bit of research there as far as humans goes. Is True North Health Center, True North Health Foundation, where I'm a board member. We actually they worked on a case study of a woman who had stage 3 follicular lymphoma, and she was able to do a 3-week water fast. The tumors substantially reduced in size. Then a 3-year follow-up revealed there was no more evidence of follicular lymphoma. So I just worked with a patient last year remotely who did a fast, and she had lymphoma as well. And she couldn't do a long fast because of her life circumstances, but she did a short fast and then did a follow-up MRI, and turned out her cancer reduced. The tumors all reduced in size. She was very happy about that. So we might plan another fast, we may not, but at least we see that there's some sort of benefit occurring. As far as definitively saying, does it work with cancer? Because there's so many different types of cancers. We don't really know. There are markers, like tumor markers, that do improve, that we know are associated with cancer growth. And so if those improve, we kind of have some hope, but a little bit early, because a lot of the studies on fasting and cancer are not in non-humans. So we kind of look at what is somebody eating and how's their lifestyle. If they're already doing everything right, then we can try fasting as an experiment. But if they're not eating that great, then we can get them on a healthy diet and see if there's some sort of benefit. So hard to say definitively.
Yep.
Dr. Thomas?
Yeah, no, I think that the big part for both cancer and MS is looking at the research behind the nutrition. There is so much evidence for cancer in particular. I think I'd mentioned to you that when I first came on your show, AJ, cancer is what got me into the plant-based movement based on my dad's story. And that is where all my published research is. I have a couple of books, book chapters published on cancer and nutrition. I went to Loma Linda to look at the Adventist health studies, which are largely around nutrition and cancer. So the evidence for reducing your risk for cancer is huge. Now, Unfortunately, it's not absolute like anything in this world, because we have environmental factors, infectious agents, lots of things that can contribute to cancer. But from a nutritional standpoint, there is great evidence that you can substantially reduce your risk by changing what you eat. Similarly, the MS question, I agree. Dr. Roy Swank, I actually have this right in front of me, I was reading it earlier today, but in following the Swank diet, which is a very low fat plant-based diet, they basically had no disease progression over 35 years for 95% of his patients. That is unbelievable for MS. That is like the most significant evidence I've ever seen, that I would just encourage someone to at least try following the Roy Swank pattern of eating if they have MS, because that result is beyond any medication we've ever seen.
Yep. But if somebody does fast, isn't it really important to follow the health promoting diet after the fast and not go back to doing what they were doing before?
Right. That's ultimately the goal, is to adopt a healthy diet. And I don't think that fasting is a really good way to springboard that. And it's a really good way to remove some of the barriers to eating a healthy diet. One big barrier is that the food just doesn't taste as good. So if you remove that barrier by getting the taste buds nice and sensitive, that's that out of the way. The second barrier could be that you're just sick and tired and your body is run down. And so you're making poorer decisions. There's one barrier that gets removed. You actually catch up on, get some energy back, and actually feel much better after a fast. And the other one is you actually get more energy back, so you can engage in some exercise, get better sleep. All these improvements in the health actually, I believe, helps the body to recover enough. But ultimately, it's on the actual person themselves, because there's a lot of different motivations that are going on in people's lives. And ultimately, those have to be, the stars have to align in just the right way for somebody to stick on the diet. And it requires, as we've heard from Dr. Lyle and Dr. Hawk, requires just the right personality, just the right environment, a little bit of luck, a lot of motivation. And it takes a lot of these little things to go right for people to stay on the diet.
Great. Diane says, can water fasting help reduce PSA numbers that are increasing? She's asking for her husband, who's been whole food plant-based for 10 years.
Yes, I have seen it. I think the highest PSA that I've seen reduced was an older gentleman who had a PSA of 68. I believe he had stage 4 prostate cancer. His PSA went to 68. We did do a fast with him. It was about a 12-day water fast, and we checked it about a week later, and it had gone to about 32. Okay. And then he actually, to his credit, he stuck on the diet rigidly. This was a very determined gentleman. And then eventually he took it again. It was 21, then eventually got down to like 6.8 or so within the next 9 months or so. But in every case of measuring the PSA beforehand and then after the fast, I've seen it go down. PSA is not the best measurement we have, but it's a great measure. It's kind of the one that we do have. And so yeah, I do see it come down very, very often.
Well, great.
Sorry.
Go ahead, Thomas. Yeah.
No, I was just going to say, one of the things with the PSA is we do see a pretty strong response to prostate cancer risk and increase in the growth of the prostate and the rise in the PSA with a lot of things that promote growth hormone. And we know that comes from a lot of the animal products that people are eating. And so that in and of itself, when people either transition to a more health promoting diet, removing dairy in particular, can start to see a drop in their PSA. Obviously, making sure you have proper medical care if you have cancer or something like that. But for just a benign prostate hypertrophy or a rising PSA kind of, even though you're having normal workup, we do see a substantial decrease. And fasting goes one step further, because when we start to fast, our insulin growth hormone goes down significantly. And so that can help reduce the growth of the prostate, or at the very least slow it down.
Cool. What are your thoughts on chewing sugarless gum?
I think it comes down to one of those things about, what about this food? What about that food, right? What is it in the context of? How much is it? And what is the health benefit versus the potential harm? I mean, a lot of people have a lot of digestive issues that they don't realize coming from chewing gum and a lot of the artificial sweeteners. Artificial sweeteners for a lot of people can also trick our brain into thinking that food is coming, especially sweet food being carbohydrates. And you can actually start to release some insulin, and that can start to cause problems, because when your insulin goes up, but you don't take any carbohydrates, your blood sugar can drop and you can start to get really hungry. A lot of people that I know struggle with their weight that chew a lot of sugar-free gum can actually find, modest benefit from not doing that practice, because that kind of doesn't do that brain trick anymore where they're going to release some insulin. That would be one thing. I mean, you're really chewing a pile of chemicals most of the time. So but for some people, if that piece of gum, for example, is stopping you eating half a chocolate cake, well, then it's probably a benefit for you. And I think this is how I practice medicine. This is how I kind of treat all of my patients and talk to people about lifestyle, is you're always balancing pros and cons, right? What's the benefit to you and what's the harm? What is doing this behavior stopping or enhancing? So I would say as a short-term practice, if it's preventing a essentially worse behavior, it's probably okay as a crutch for a while, but I wouldn't consider it to be a long-term health promoting practice. And I would lead someone into finding an alternative option for that over any kind of sustained period of time, more than probably a couple of weeks.
Thank you. All right. Are either of you on social media? Do you like people to follow you? How do people get in touch with you? The information is in the show notes, but this is just a general
So
question.
for people who are looking to do a consult with Dr. Thomas, and that's I want people to be able to book a consult with Dr. Thomas, because the website fastingescape.com, you just go to about Dr. Thomas, and that's how you can book a consult with her. So and Dr. Thomas, I don't know, are you on Instagram and social? I don't know too much about those. I know you're trying to teach me, but I don't know too much about those. I know you have an Instagram handle. What's that one?
Yeah, pretty much everything I have is Dr. Renae Thomas, and my Renae's spelled a little weird, so definitely check out AJ's show notes because it'll all be linked there. But everything I have is Dr. Renae Thomas. I love Instagram. I've just started getting back into YouTube, so I'm having some of those coming out soon and just kind of growing from there. I'd love to interact with anyone there, but more importantly, I'd love to see you if you need any help getting, your healthiest and happiest self. Feel free to book in and we can kind of chat about your health and getting to your health goals.
That's great. Well, thanks. You guys have been a wealth of information. I'm looking at your Instagram. Yeah, you've got my picture on it because you're on the show today. Thank you.
Absolutely. Of course.
Oh, and you've got your diploma certified in lifestyle medicine. Ooh, that's amazing.
I finally put them up on my wall. I've had them like in a drawer for so long that I finally put out my diplomas. It's pretty cool. This is what my entire 20s look like, by the way. So yeah, thank you.
That is great. Susanna says, these two are a dynamic duo. The whole food plant-based world is better for this pair. That's neat. I like what you were saying about knowing why you're doing something, because I always think about Dr. Goldhamer saying, well, just because something is less bad doesn't mean it's good.
There's some wisdom right there. Yep.
Yeah, absolutely. Well, thanks, guys. This has really been a really lively, fun show, and every success in the virtual fasting world. If maybe I could fast virtually and like just pretend like I'm fasting.
Well, you already do fast virtually. You just do it between dinner and breakfast. So
that's true. Yeah, I never knew it was a thing, but I just that's true. Well, that's great. Well, thanks, guys, so much.
All right. Thank you so much, Chef AJ. Thanks for having us on.
So much fun. And thanks, guys, for all your great questions. Stephen, I hope you feel better from your little hospitalization. And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow for 2 shows at 11 o'clock, the regular time. My guest is Shira Aguirre. She's going to be talking about living joyfully with heart disease. And at 4 p.m., we have a bonus show with one of my favorite plant-based chefs, Vicky Gack-Brett, and she's going to be making, listen to this menu, ratatouille, flatbread pizza, chimichurri, corn on the cob, and I saw and mashed potatoes. Doesn't that sound good? Oh, but we don't want to talk about this for people that are fasting. Don't people that are fasting get obsessed with watching the Food Network for some reason?
Sometimes, yeah. There's definitely, when I'm doing cooking demos, there's some people that just won't watch them and some people that will. So
that's so funny.
When I was fasting, I watched Hell's Kitchen, like a whole few seasons of Hell's Kitchen. So that was interesting.
That's funny. All right. Well, take care, everyone. Bye-bye.
Thanks so much.